A pleasant day to all. This video will cover everything you need to know about the different exceptionalities of learners in special education program of the Division of Parañaque City and how the parents will facilitate learning at home using a modular instruction in this time of pandemic. Special education is a specially designed instruction that meets the unique needs of a child who has a disability. Special education makes it possible for your child to achieve academic success in the less restrictive environment despite their disability. SPED provides support and interventions needed to help these children succeed in school so they can go on to be successful in their adult life. The school's division of Parañaque City has been catering to the different types of exceptionalities. Currently, there are 11 schools offering the special education program. Knowing each type of exceptionalities for children with special needs will greatly help each of us to understand on how to deal with them and ultimately provide them the support they need to be independent and successful. Let us dig into each one of them. Learning disability, autism, orthopedic impairment, intellectual disability, speech and language difficulty, multiple disabilities, visual impairment, developmental delay, hearing impairment, and other health impairment. Next, let us have their definition, characteristics, and intervention and assistance that we can give the students having these difficulties. First, the learning disability. It is a disorder in one or more of the basic psychological processes involved in understanding or in using language, spoken or written. They have difficulties with specific academic skill sets like mathematics, reading, etc. They must be given with activities that will strengthen their potentials, focus on the specific weakness that they struggle with. Autism. It is also known as Autism Spectrum Disorder or ASD, like Asperger's syndrome that belongs to the high-functioning skills. It is a developmental disability significantly affecting verbal and nonverbal communication and social interaction, generally evident before age 3. They have engagement in repetitive activities and stereotype movements, wants structured routines, communicates in their own ways, and has unusual fixations. Should give clear instructions one step at a time and use various cues. Teaching children with autism is quite difficult because of the wide range of characteristics that they possess. Next is orthopedic impairment. It is a severe impairment of the bones or muscles that adversely affects a child's educational performance. Students suffer severe burns, deformations, bone abnormalities, and distortions. Their learning area must have clear paths and be given a seat away from distraction. Another is intellectual disability, significantly below average general intelligence existing with deficits in adaptive behavior. Have an IQ level below 70. They have difficulty in comprehension and functional life skills. We should use concrete examples, utilize manipulatives, and give simple and clear instructions. Speech and language difficulty is a communication disorder such as stuttering, impaired articulation, language impairment, or a voice impairment that adversely affects a child's educational performance. They have trouble in communicating, doing class presentations, and participating in oral performances. They should undergo speech therapy and give activities that will enhance speaking skills. Multiple disabilities. It is a simultaneous impairment, such as intellectual disability and blindness, occurring at the same time. Unfortunately, they need care throughout their entire life because some have difficulties in breathing, reading, seeing, etc. They have to utilize assistive technology and devices. The visual impairment. It is an impairment in vision, even with correction glasses, that adversely affects a child's educational performance. They have difficulties in reading, utilizing technology, and have a range of eye conditions. They have hard time identifying letters. Use of large print books helps great, and assistive technology is necessary. Developmental delay. It is when children aged 3 through 9 with a developmental delay in physical, cognitive, social, emotional, or adaptive development. They have less developed mentally or physically as compared to children of same age. They must be given early interventions. Activities must help them develop and cope up with their age-appropriate skills. Hearing impairment. It is an impairment in hearing, whether permanent or fluctuating, that adversely affects a child's educational performance. They have trouble in vocabulary, grammar, listening to lectures, and participating in conversations. They use voice articulation, sign language, note takers, interpreter, and assistive technology. And the last is other health impairment. Includes a range of conditions such as having limited strength, vitality, or alertness due to acute health problems. Academically, students have trouble due to their ADHD. They should be provided with activities that will get their attention, keep them away from distractions, and prepare more varied activities. Parents and guardians will have a vital role in delivering learning, as it will be a study-at-home setup. In this new normal wherein face-to-face learning is not allowed, providing modular instruction is the new hope for our special education learners. Every child has the right to learn, more so the children with special needs. Education must continue even with the temporary closure of schools due to COVID-19 pandemic. Study from home using a modular instruction is the default learning scheme that will be employed for school year 2020-2021. Homes are now the centers of learning in the new normal, and the parents or guardians will now be the facilitators of learning. Teachers, on the other hand, will assist and constantly collaborate with the parents in order for them to properly undertake the task given for the certain lesson. After knowing the different types of exceptionalities of learners in special education, here are some tips to parents and guardians which they can follow to support learning at home for children who may be experiencing challenges and difficulties. Designate the study area that is away from any distractions to set the mood for learning. Establish clear rules for behavior. Always communicate with the language they understand best. Identify triggers of bad behavior and try to avoid them. Do not rush the children in the task and give them time to practice. Have a lot of patience. Break big tasks into smaller steps. Present information visually and verbally. Ask child to repeat instruction for better retention. You could also use finger to follow along with text while reading. Encourage them to ask questions. If you don't know the answers, don't make one up. Tell them it is a good question and make a note to check with the teacher later. Give positive feedback often. Example, good job, excellent, very good. Reinforce and reward positive behavior. For children with no focus and short attention span, we should sit the child away from distractions. Allow the child to take breaks. Always say the child's name while talking to them. and keep an eye contact. For the references, you could check on the materials listed here. Before I finally end, let us remember that kids with disabilities are just kids. They are children achieving their potentials. Let us bear in our minds that every student can learn. It's just not on the same day or in the same way. I hope you learned something from this video. This has been Miss Gemruth E. Gallardo, a special education teacher.